moving on to AI agents and why I think these are relevant. The health system is very complex and there's many different functions that, in this case, a doctor, this little graphic here, needs to think about as part of their day-to-day work. But there's also a lot of other team members that are working in healthcare, and there's a lot of cross-team collaboration that needs a lot of work and a lot of oversight. If you think about all of the various activities that happen in a health system, in the day-to-day work, you can easily see why having specific agent flows might be really helpful here. If you think about a doctor, they might want to pull up all of the relevant information for a particular patient, or pull up their recent conversations with a patient. They might need to order an MRI for that patient. So how do they kick off that process? All of these things are very process orientated. When the results come back, what's the most relevant information from this? What has changed from previous diagnostic scans? What's the next best step? Help me kick that off. So there's a lot of different workflows that you can think about within healthcare, and a lot of variation in them, and I think that's a neat fit with AI agents. This is just, like I said, walking through maybe one routine for a doctor, but there's lots of different use cases within healthcare. Not all of them are diagnosing people or things that doctors would use. So you can see a lot of workflow things that are more administrative. When we talk about care navigation, that means helping a patient or somebody find the right type of care that they need. Do they need to see a specialist? Do they need to see a doctor? Can that visit be a telemedicine visit versus an in-person visit? So there's lots of different things that need to be solved in this. And right now it's all done by humans, but in the future it doesn't have to be. There's lots of different solutions that are being built up in this space.